I would like to ask all members of the European Public Health Alliance, but also those members of the Roma Health Network, to accept my gratitude for all of their hard work and for the support that they have shown in the times when I was by you. Thank you so much. And, some parts of the success that I'm enjoying now, it's also because of you. Thank you. Now, getting back to my conclusions, I would like to speak now not from the position of a senior advisor on non-discrimination and Roma policies in the office of Mr. Franz, but as a simple Roma. You all know that all that I did and all that I'm doing is actually by thinking first to those people from the ground. This is actually something very strong that connects me and Mr. Franz. I am a Roma. Mr. Franz is a Sinto. We are Romani people. And I was so happy to hear some of you using this new terminology, which is also asked in the resolution, Romani people, because this shows very well our diversity. I would like to focus a bit on the solution, on the major source of hope for our people. In the end, the major source of hope for our people is, of course, in the hands of our Romani people, but they must be enabled first. And I think the resolution that was adopted by the Parliament on 17th of September, gives them this power to enable themselves to make the change they want to achieve. However, the Parliament did the first step, a very courageous one. Many are saying it's an historical one because in the history of more than 60 years of this Parliament, it is for the first time when an MEP, here Mr. Franz, had the courage to develop a resolution and ask for a Romani law. Now, it is the time for the Commission to be more ambitious and to be more courageous, to not be afraid about the fact that they will fail, because fail means first attempt in learning. So putting on the table of the Parliament and the Council a legislative text could be the most courageous step towards Romani equality, inclusion and participation that the Commission might take. The argument is the following. Now the chances are bigger. Why? Because Article 19 of the treaty, paragraph 2, says that the Parliament has 50% power on the adoption of a potential directive. So it's not only unanimity in the Council. Being afraid that we are going to lose more than 10 years waiting for this to happen, it is an argument. But it is not a strong and valid argument from my point of view. Because if you will go right now in a Romani community marginalized, when you will see children starving, going to bed hungry, and they will ask you, what are you doing there for me? I'm wondering, what is the answer? So instead of being afraid, I suggest we take some risks, as we did in the Parliament. Nobody believed a resolution asking for a law would have been possible. Absolutely nobody. It was only Mr. Franz and myself. And in the end, 545 other members. So around 80% of this Parliament is behind this resolution. And I think this is a strong enough political message from the highest political institution in the EU to at least make the Commission understand that they can take some risks. Doesn't matter if other minorities are coming to them asking for a directive for themselves too. It's okay. We cannot solve specific issues with general solutions. We need specific targeted measures for specific issues, but without making them exclusive. So I am thankful to all of you because you have managed to put together a group of people sharing a common purpose, common interest, with different skills and knowledge that are ready to build the power they need to make the change they want. And I hope this will not stay only at the level of the rhetoric. And how I know the people from IFA, I know this is not going to happen. I know a lot of actions is going to come.